Now with a segment on pulmonary disease, which affects 16 million Americans. Here's our reporter, Laura Windsor.
We take breathing for granted, but for many it is a daily struggle to survive. COPD stands for chronic obstructive pulmonary disease that covers a variety of lung diseases from long-term asthma to emphysema. Dr. Theodore Shankel of Redlands Community Hospital in Redlands explains the treatments available for the diseases.
Chronic obstructive pulmonary disease, it basically is a catch-all term for a variety of obstructive lung diseases, emphysema, chronic bronchitis, a disease called bronchiectasis, and long-standing asthma. The main test we do is what's called a pulmonary function test to measure the flow rates, the ability to force air out, and the lung volumes. If you're somebody that has that diagnosis, has been seen, and is being treated for it, you often have various inhalers that you can use. Usually we use what's called an albuterol inhaler. We'll call it the rescue inhaler. Or there's nebulizer machines that we provide for patients. We talk about pursed-lip breathing to try and slow their respiratory rate down, try and help them exhale and get more air out of their lungs because it's an obstructive lung disease. So the problem actually is emptying the lungs of air. So if you can slow it down and get more air out, then you can get more air in on the next breath. Our typical patient is going to range generally in age from late 50s to early 70s. Most of them are ex-smokers, fortunately. There's still some that are smoking, but majority have stopped. And they are at the point where their capabilities, their functional and physical abilities have declined. They get short of breath, walking a block or two. Probably 30–40% of our patients are on oxygen at least part of the day. And they're all, of course, on various inhalers. I suspect that, the main advance that we're going to make is in fewer and fewer people smoking. So the incidence of COPD is going to decrease because of that. Pharmaceuticals will probably make slow, steady improvements over the next 10 years in that field. Lung transplantation, probably not going to be a great answer for people with severe emphysema. I think the main thing to improve your overall health as far as your lungs is the very beginning, don't smoke. And if you are smoking, stop smoking. And then things that we do to try and help our patients with lung disease is make sure they get the flu shot every year, make sure that their pneumonia vaccine, the Pneumovax, is up to date.
COPD is the fourth leading cause of death in the United States, but you can minimize your risks by not smoking. I'm Laura Windsor for the American Health Journal.